Hey guys, my name is Caitlin Lackey. I'm with InStride Chiropractic, and I'm here to talk to you a little bit more about my monthly blog topic, which is how does the adjustment work? I am here to work together with you and your veterinarian or provide alternative and integrative holistic pet therapies. And we're going to talk a little bit more about adjustments today and what they do and how does it work. So there are several questions I get asked about adjustments. In particular, what an adjustment is it's finding two bones, a joint where they come together, that is either malaligned or is not functioning correctly. So when these don't function correctly, it's not moving, whether it be jammed together or just stuck, what I'm going to do is I'm going to reset that and correct the motion so that way it can function better. Well, this has an effect not only at this level, on the mechanical level, it also has an effect lasting on the alignment as well as the brain because it helps to stimulate the brain through motion. So we're going to talk a little bit more about each of these individual pieces. And today in particular, I get asked, well, how is the adjustment working on a joint level? What is the pop? So if you actually go to a human chiropractor yourself, you've probably experienced this. When a joint is compressed or too close together and you suddenly open that, it creates an opening effect, kind of like a suction cup, and it will create a gas bubble that will pop, make a big, huge popping noise. So two bones here, you want to think or visualize your knuckles. That's a fairly easy comparison. But these bones are being pulled apart, essentially, not literally, but being moved further apart from each other. And this represents the capsule right here. That is a ligamentous bubble around the joints that's holding it together, kind of like rubber bands. And those rubber bands have a capsule in there that is actually full of like a jelly-like material. So that jelly-like material, when it gets moved around through the opening there, actually creates additional space that has gas in it. That gas is going to open and pop, and that creates the cavitation that we are most familiar with. Now, if you go to a human chiropractic office and you get adjusted yourself, you'll say, oh yes, it feels awesome when I hear that popping noise. But the popping isn't actually necessary in order for an adjustment to be effective. You just want to make sure that the motion is restored afterwards. We all love a good pop, but actually humans pop more than pets do. Since I adjust both, I can comment on the differences between them. Humans are up and down in nature. We are upright and we are fighting against gravity, whereas pets are more like a bridge and they collapse this way instead of, being compressed this way. So these arrows are like gravity that is pushing down on those bones. And as human bones get more compressed, what the adjustment does, it helps to open those up. And since we are always compressed due to gravity, you're going to get more popping noise with adjusting humans. Pets, though, are oriented like a drawbridge, just like I said. So through the adjustment, going this way, we're actually going to create more of a sliding effect. So this sliding effect usually doesn't have the jarring opening that the other adjustments do on humans. So for that reason, pets don't pop like people do. Unless it's a load-bearing joint that is, against gravity, such as the shoulders, the hips, the knees, many times your pets actually don't pop. If your pet actually does pop during an adjustment, sometimes there is harm that is happening. So I do recommend that a pet doesn't have as loud as a cavitation as a human would. It's more of a soft poofing noise than a popping noise. So that is a very common misconception I have. Thirdly, what we're going to talk about is alignment. So if these bones are jammed and they're stuck in improper alignment, they aren't moving correctly. And because of that, say this is like the tires on your car. If your tires are malaligned, these represent axles here. If this axle is bent, you're going to see more wear on the side. As you are driving straight, you're going to see more wear on the side that is being used more. Just like anything, your teeth, your tennis shoes, or your car tires, you will see wear in areas where there's improper alignment. The body's supposed to function as a whole, and it also needs to have equal amount of pressure since we are, symmetrical in nature. So if we have symmetry our body is better able to function, and we are less likely to see things like joint arthritis, excessive muscle spasm, or differences between the side-to-side muscle tone, which can cause, a whole host of other repetitive use injuries. So, with that being said, we're helping to correct the alignment, so that way we don't see improper wear from asymmetrical alignment. Now, lastly, what we're going to be talking about is the brain-to-body connection. The body, with an adjustment, is actually being stimulated through motion. And we'll talk about that here in a second. But your brain here is an awesome structure. I like to call it the supercomputer of the body. And it connects to what we call the spinal cord. The spinal cord is like an extension. And it has little tinier extensions called nerves that go to the important stuff like your heart, your lungs, your bladder, your stomach, maybe your muscles, what have you. They go to everything. And since they go to everything, they control everything because they directly communicate up to the brain about what is happening at that level. Your brain sorts through all that, but you actually have several components of your nerves that are working on separate individual functions. So in a company, this is say like your marketing agency, and then this is say your financial accounting agency. And there are other things that are happening as well, but I'm going to consolidate them into just three. These are the biggest three. The first one is motion. So your body at any given moment has to be fighting against gravity to keep you upright lest you want to fall down. So our motion receptors are always aware of, say, where our finger is so we can move it. It's always aware where our feet are so we can run. It always has to be aware of what is going on with the motion of the body. And the brain actually responds really, really well to motion because it relies on that motion in order to be awake, if you will. The second one is autonomic function. These autonomic nerves help to control things you don't think about, whether it be your heart beating or your lungs breathing or your digestion. It's very important that these nerves control them while you're not thinking about it. Then lastly, the smallest sector here is actually pain. So this is one reason that I tell people pain is actually the last thing to tell you that you need to get an adjustment, because there's two bigger sections right here that you are ignoring. So pain are very small fibers, and they will actually tell you, hey, this hurts, whereas there are the other two bigger functions, say a loss of range of motion or a loss of the ability to do X, Y, Z that you don't even think about, that we will see before we ever experience pain. So these individual little sections of a company will come together in that nerve, and that nerve will provide information up to the brain, the supercomputer, the head honcho, and it will help to control all those functions within those sectors. So when I adjust the joint and I correct proper range of motion and alignment, it helps to stimulate this motion component, which goes directly up to the brain. It helps the brain have a better awareness of where that body part is. Say I adjust the elbow, it tells it where the elbow is. If I adjust the knee, maybe it tells it where the knee is. But as you can see, if I get that communication restored back up and down, it can help to control other things as well. So anecdotally, we see that these nerves here, say in the neck, if you get your neck adjusted, sometimes you have a better blood pressure because it helps restore the communication between the heart and the brain. So that being said, adjustments are super powerful. They help to open up a joint so that way we can get some really good pops if we're people, but in pets we notice that they're sliding, so we're going to get some poofs, which will help to restore proper alignment, which will help our body function long term so it doesn't wear down. And we're also going to stimulate the brain through motion, in particularly to help restore that communication back up and down. So that was really technical. I explain it a little bit better in written word. So I do invite you to read my blog on instridechiropractic.com. And if you have any questions, don't be afraid to reach out. But I look forward to working together with you and your vet to get your pet back to feeling and functioning better.